It's the painful condition women and men don't talk about: chronic pelvic pain. Women with this problem experience extreme pain during intercourse, sitting or walking, or even just wearing jeans. Millions of women and men will be affected over the course of their lifetimes, yet many suffer in silence, or even worse, are sometimes told by their doctors there's nothing we can do. But experts say there's absolutely nothing normal about chronic pelvic pain, and women and men need to seek help.
The truth about chronic pelvic pain is that there isn't enough research being done on it. And because pain involves the nervous system, many times doctors will say it's all in your head. Yes, it is all in your head. That's what's feeling the pain, but that doesn't mean that you have a psychiatric disturbance. And many doctors are quick to tell patients, you're just crazy.
Many women develop chronic pelvic pain after an infection, surgical procedure, or childbirth.
I didn't really know where to turn to. I had passed with flying colors on the 6 weeks examination. I couldn't do a lot. Basic errands, housework, even caring for the baby, carrying the baby, but the pain just kept going.
My first symptoms were bladder symptoms. I had a lot of bladder pain. They quickly moved into general pelvic pain, spread through my abdomen and into vulvar pain. Movement was very difficult. It was hard to walk around. Intercourse became nearly impossible.
Isa Herrera is a physical therapist who specializes in treating chronic pelvic pain. After hearing her clients complain about chronic pelvic pain and then eventually experiencing it herself, Isa became determined to better understand the cause of this pain and develop solutions based on physiotherapy and holistic approaches.
The pelvic region is very susceptible to chronic pain because one is the relay station. It is the station that connects the upper and the lower extremity. Not only that, on an energetic level, it's the site of the first chakra, and it's really susceptible to infection. Many surgeries are performed in that area. Two traumatic falls and injuries to the area are very common. And third of all, it has a lot of blood supply and nerve supply in that area, a lot of it.
Through a series of individualized physiotherapy treatments, along with exercises, stretches, self-care, and improved mind-body awareness, Isa says patients can oftentimes significantly reduce or even eliminate their chronic pelvic pain.
For chronic and pelvic sexual pain, we recommend a lot of different treatments. We recommend biofeedback technology. We also recommend foam rolling and yoga. Those are very big for us. Pelvic floor, intravaginal, intrarectal massage and trigger point techniques. We also recommend definitely relaxation and breathing exercises, which are an important component of the foundational core exercises that we teach everyone.
After following Isa's plan, Alana and Kathleen have experienced significant relief.
I feel really good. I wish I'd known and started sooner.
This program has completely changed my life. I move with ease now. Intercourse is comfortable and fulfilling.
We have to, as doctors, do a much, much better job at, number one, treating chronic pelvic pain, doing research on it, and most importantly, listening to our patients and coming up with a multiple team approach that involves not just doctors, psychiatrists, pain medicine people, physical therapists, acupuncturists, everybody involved, because it's a big problem.
Isa Herrera is a pioneer in women's health. She has brought to light chronic pelvic pain, a rarely discussed condition that affects millions of people of every age. Those who complain to their doctors about chronic pelvic pain are often placated, told that their pain is normal or even imagined. Isa is fighting to expose chronic pelvic pain for what it is, a real condition that can be overcome.
Having suffered from chronic pain myself after the birth of my child, I looked for help everywhere. And I said, I cannot be the only individual in the US suffering from sexual pain from a perineal tear. And I went and I did a lot of work. And the old adage that says, heal yourself. Well, that was my journey, that was my trip.
In her book, Ending Female Pain and companion DVD, Isa guides readers through uncovering the source of their pain and recommends physiotherapy and self-care routines and treatment plans for people to follow at home. At her practice, Renew Physical Therapy, on Madison Avenue in New York City, Isa sees patients from all over the world who are desperate to conquer their chronic pelvic pain. These men and women undergo a 5-day physical therapy and holistic wellness intensive to give them a jump start on the path to healing.
The Bootcamp Intensive is an amazing program that we offer. It's for people who don't have access to the care in New York City. They travel from all over the world to come and see us. It's 2 to 3 sessions a day, and we really show them what to do on their own.
Through her program, Isa has empowered thousands of people to take control of their health and return their lives and relationships back to normal.
Isa has really changed the way I feel about my body. It's been a tough road for me. I've had a lot of upsetting things, and going forward, she's really given me the tools to treat myself and deal with myself. And one thing I will never forget, she said to me, some women never have to think about their vaginas, and you do, and I do. And she's right, and that's not necessarily a bad thing. Isa has given me the tools to move forward, and I'm incredibly positive. So it's changed my life.
I had to urinate more frequently. I had constant dribbling that kept getting more and more severe as time went on. I went to my urologist, and his recommendation was, you can either go on meds or we can get you to someone who I think can help address this problem, because I don't think it's an aging problem. It's a matter of learning how to control the issues you're having, the pain you're having with this. Isa and her group have been very good for me in restoring a sense of calm and learning that I can control my own body and heal myself. I'm just very grateful to have learned of their existence and been able to work with them to accomplish this.
Isa is bringing European ideas to American women, and I think that they're going to help American women get their pelvic floor back together, prevent them from having incontinence, enjoy sex, and avoid pelvic pain during sex.
Women and men don't need to live with chronic pelvic pain. For more information and treatment options, visit renew-pt.com or endingfemalepain.com.